for joining us on the show. Thank you.
Thank you so much.
Ashura Ramadan once again.
Thank you so much, Alan Kelly.
All right, and let's talk a bit of health now. And it's a record that vaccination provides the longest lasting and most effective protection against diseases, which can lead to life-threatening complications for the vulnerable population. Also, vaccine preventable diseases account for 20% of morbidity and mortality of children under the age of 5. Although Nigeria received 1 million doses of the new Menfive vaccine, a meningitis vaccine from the Gavi-funded global stockpile to address the ongoing meningitis response in Jigawa State.
Okay, of course, some experts are raising concerns about what will become this kind of strides in getting vaccines for critical outbreaks as Gavi exits the shores of the country. This comes as more advocates push for improved funding on immunization in order to reduce vaccine shortage and of resurgency of vaccine, the preventable disease in the country. I think this is a good conversation that we need to have. When you look at, I remember when I got my vaccine. I think I was 8.
You could remember you got your meningitis because it's one of the things we get as
like 5.
Yes. Okay. So, but I also think that in over the years we have received vaccine, and I'm wondering why we're not thinking about producing these vaccines ourselves. So, because now Gavi is exiting, and we're all panicking, like, what's going to happen? Are we all going to have stuff having turned neck? So,
I think that the Nigerian government and whoever is saddled with responsibility, the Ministry of Health also needs to come into play, where young minds need to come into play, where they can be able to
in terms of production.
In terms of production, how we can be able to produce our own vaccines and use it for our own use. Okay, interesting.
Well, the CEO and founder of Initiative for Health Accountability and Transparency, Dr. Abdullahi Mohammed, is live in the studio to throw more light on this achievement. So my very first question would be, how would you assess Nigeria's efforts in combating vaccine preventable diseases in recent years so far?
Yeah. Good morning.
Good morning, sir.
Thank you very much for this opportunity. I think the country has done well, fairly well, but there's still a lot to cover. A lot to cover. I mean, today, our national immunization coverage isn't optimal, it's suboptimal. Low coverage, possibly lower than most of our neighbors in West Africa here, but still better. Previously, it used to be between 26, 29, 30. But now, 2/3 of Nigerian children, 0 to 12 months to 24 months, are fully covered. So we still have about 1/3 that is left out. And that means there is the possibility of breakouts in these people. They are vulnerable, they have low immunity, and we must protect them. So protecting them is key, but beyond routine immunization, there are other achievements in that area. We know we have done quite a lot in terms of polio eradication, a lot of progress. It came later than we expected, but we had it. And today we have sustained it, even though there are little problems here and there because of vaccine-derived polioviruses. And these are basically more in areas where you have very low immunization coverage. And we still have them in some parts of the country, particularly in Northeast and the Northwest. On COVID-19 vaccine, we also did quite well, but there's still also a lot to do. We have weak systems. I think these are areas that we need to talk about to see how we can strengthen the systems. I heard you talking about vaccine security, yes. But then beyond the security, you also need to deliver the vaccines. When you have vaccines, you have sufficient stock, but it must get to those people that need it. So we need to build a system. This can only be done through a functional system. Incidentally.
All right. Okay, so because, I mean, you already started the conversation because, talking about how much Nigeria, the significant strides in terms of vaccination campaigns against things like COVID-19, the ongoing HPV vaccine, and then efforts being made in eradication of polio. So, however, there still remains a gap in acquiring certain vaccines that are crucial for building a stockpile to protect children under 5. What factors contribute to this delay, and why is it imperative to procure these vaccines?
Yeah, very excellent. Vaccine security. You must have sufficient stock. it's important to recognize that Nigeria annually we expect about 7 million new babies. 7 million. You can see most of our neighboring countries, population of 1 to 3 million, less than a million. But Nigeria adds additional 7 million babies annually. So that means there is a lot need for vaccines. So we need to also have vaccine sufficiency. And that is where we have problem. Yes, somebody will ask, why wouldn't we be producing vaccines today? Why must we import vaccines? If you go back to history, yellow fever vaccines were first manufactured in the medical compound in Lagos several years ago. A lot of research on malaria vaccines also started in Nigeria, but we lost it along the way.
You know, talking about losing it along the way,
yes.
And now that Gavi is exiting
yes.
the country, how do you think that Nigeria can sustainably fund its immunization for the next 4 years?
Yes, very exciting.
In 30 seconds, if you can help me do that,
yes, we have to do that, and we can do that. Vaccine financing have improved in the past few years, particularly from 2019 to date. And if we step up our allocation, and then we look for innovative financing mechanisms, I think we can do it. And we must know that we need to identify these mechanisms, one of which is, if we float a national vaccine fund today, we have a lot of goodwill. We have foundations that can come in. And I think these are some of the things we need to look at. We need to float national vaccine funds for which private sectors, particularly the private sector alliance, can come in. But beyond that, I also think that things like the basic healthcare provision fund that we have now, the initial focus was to look for 5%. We got 1%. There's no reason why we couldn't today up it to 5%, in which we can allocate 3% to vaccines. But most importantly, we need to move vaccination financing from the sector-wide vote to what we call direct allocation, so that it's not a sector-wide thing.
Thank you very much, sir. I really appreciate
Thank you very much.
Thank you so much for the education.